The Biden transition team is getting down to business in planning a national response to coronavirus. Earlier this week, Biden assembled his coronavirus task force, a team of doctors and health experts that will help shape coronavirus containment policy for the Biden administration starting on day one, hopefully before day one. One of the doctors on that task force joins us now, Dr. Celine Gounder, epidemiologist, clinical assistant professor of medicine and infectious diseases at NYU's Grossman School of Medicine, and now a member of the Biden-Harris coronavirus task force. Dr. Gounder, good to see you again. Thank you for being with us tonight.
My pleasure, Ali.
I want to understand. I know that there are many of you very qualified people on the two different groups that the Biden administration, or the incoming Biden administration, has put together. What does it mean to us on the receiving end? What does a coordinated federal response look like? Is it stuff that the administration does? Is it pulling all the governors together and creating a standard that makes sense? Is it using the CDC and the NIH the right way, unlike this administration is doing? What does it look like?
Well, it's all of the above, Ali. I think part of what has been in the works for months now is developing a blueprint, a plan, how to operationalize that plan in terms of how to control the pandemic in this country. And that requires a federal response, but it also requires a state and local health response and the involvement of the private sector. And so what you're going to see in this new administration is you're certainly going to see the CDC taken off the sidelines, back in the center of the game. You'll be hearing from people like Nancy Messonnier and Anne Chouchat again. These are career scientists at the CDC who are really expert in this area. And you're going to see improved coordination with governors, with state and local health departments in terms of implementing the CDC guidelines. And finally, in terms of the private sector, when we talk about how do we scale up vaccines, how do we scale up testing, how do we scale up some of the new therapeutics like monoclonal antibodies, that is very much going to require the participation of the private sector to distribute and disseminate all of those new technologies.